Physical attacks and verbal abuse are targeting those we trust with our lives, doctors, nurses, and others on the front line of healthcare.
This wasn't just kind of a little slap on the face or anything like that. I got full-on punched.
And you look at these, you didn't know what this person was capable of doing.
No, I had no idea, and clearly even after the punch, when she was intending to injure me further, it was terrifying.
For nurse Lisa Fisher, the bruising from her attack inside a Maryland ER 2 years ago has faded, but not her memories of what happened that day after triaging a patient.
She basically stood up and cocked back her wrist and punched me in the face. I was shocked. It actually pushed me off my chair. I fell over. When I got up to leave, she blocked my way out of the room, so I was trapped in the room. She picked up a chair and was coming towards me with the chair, and fortunately, some of my colleagues heard something and interrupted her.
Fisher says that patient gave her no warning and was eventually arrested.
What goes through your mind as that's unfolding, because you're trapped in that room?
Absolutely nothing went through my mind. I went completely blank. I was totally stunned, totally shocked. I couldn't remember the number to call the security office. I mean, I couldn't remember anything. I was just totally caught off guard.
One of her friends used to work at the York County, Pennsylvania hospital less than 60 miles north of Baltimore, where earlier this year a distraught man used nurses as human shields, zip tying them together before shooting a nurse and doctor. A police officer was killed in the violence.
It is terrifying, and I think that it's not isolated to my department. It's not isolated to Maryland or my county. It's all over the country.
It's not a felony to attack workers.
It's a felony to attack an airline worker, a police officer, a firefighter, even a cat. But it's a misdemeanor to attack a healthcare worker. So part of the outcome of this is that I've become an advocate for some of the laws and things to try to strengthen that.
Most people would be surprised by how much violence happens.
Maryland is trying to alert the public to the problem, launching a campaign to show the impact of violence and working to change behavior.
We just ask that you give us the same patience.
It's not okay that these people who are showing up every day in sacred places like healthcare are experiencing this kind of violence towards them. And so we hope this campaign will help address and humanize that so that we can make a dent in the problem.
The president of the Maryland Patient Safety Center says violence in hospitals and clinics, while common, can be hard to track. A 2023 study revealed 8 in 10 nurses experienced workplace violence over the past year. 68% were verbally threatened, 36% were slapped, punched, or kicked, and 30% had bodily fluids thrown at them.
I just heard yesterday, as a matter of fact, about a nurse in the state of Maryland who was hit purposefully in the head and has suffered a brain bleed. Is a verbal threat enough? Does it need to be a physical altercation? These haven't been defined, and so it leaves healthcare workers a little bit unsure of when and how to actually report healthcare workplace violence.
I personally have been swung at, kicked at, had objects thrown at me, pieces of furniture thrown at me. There are multiple bodily fluids in containers that have been thrown at me.
Dr. Patsy McNeil is the Chief Medical Officer for Adventist Healthcare.
The incidents are definitely on the rise, and the level of aggression we're seeing is a lot more intense than it used to be when I was back getting training 25, 30 years ago.
What do you think's driving it?
Aggression comes from fear, mental illness, as well as just plain stressors from life in general.
And violence has become accepted, even celebrated.
We, the people, want Luigi free!
Thousands of people showed up to support Baltimore native Luigi Mangione, now facing the death penalty for shooting the CEO of United Healthcare.
I think it would be inappropriate for us not to recognize that people are struggling, and struggling quite a bit. And that's driving that Mangione case reaction quite a bit, and it's driving the violence we see. Having said that, it's never acceptable for folks to go outside the boundaries of well-mannered, ethical standards of behavior to be able to interact with their fellow human beings.
Unlike most states, Maryland requires hospitals, including McNeil's, to have violence prevention plans. Across the country, some medical centers have metal detectors, even panic buttons for staff. Adventist provides a unique service, medical forensic exams for any victim in the state.
I really hope that healthcare workers, because they experience so much workplace violence. I hope that they know that there are resources available to them.
Lisa Fisher says her attack had a lasting impact on her ER.
As a result of my incident, one person actually retired, another person left the emergency room, and another person reduced their hours because they just didn't feel safe in that environment.
And even though she loves the job, she lives with the nagging fear. Will it happen again?
I did have a pretty impressive black eye. I did have the 3 stitches. I think the mental impact is what lasts with you the longest.
Mike Helgren, WJZ Investigates.